So endoscopic lung volume reduction is a big business now. It's booming. We have more and more data. And therefore, we come up with every year a new recommendation of the experts. What should you do? And to be honest, it always came back to patient selection. So we have to select the patient in the best way, using lung function, clinical information, as well as quantitative CT scans. And then we can decide, is the patient a candidate? And if he's a candidate, for which of the technologies. Following that recommendation, I think we can, independently to the technology, showing a success rate from a patient perspective up to 80%. So we have, for all the technologies, we have specific risk factors, we have specific risk and complications afterwards. For the valves, it's the pneumothorax. For the foam and the steam, especially for the uptake company, it's a little bit the exacerbation we are creating. And for the coils, it may be on the long run hemoptysis. So it is something we have to debate with the patient in advance, so the patients are prepared what can happen and they are not really completely overrun by the situation. At the moment, there's a huge interest on the vapor technology, because the vapor technology is independent to the fissures, which is something we're seeing on the CAT scan if the lobes are divided completely. And the vapor has the advantage that we can step up the technology. So we treat a subsegment today and another subsegment later, and maybe a third and a fourth subsegment later in the career of the patients. So it's really a technique where we can precisely use to shrink the lung. When the disease is progressing, we can use it again. So for me, it's an ideal technology where we can use multiple times to keep the healthy level of the patient quite high. So for the coils, we just have seen two huge publications, Renew and Revenance, showing that we need improving our patient selection criteria for the coils. When you only look to the CAT scan by eyeballing, the results are not as good. We also need for the coils a quantitative CT scan, and then we really can select the patient in the best way. From the safety profile, it might be the safest technology when you're implanting it. We have a low pneumothorax rate, a low COPD exacerbation rate, but at the end, the patient is willing to undergo the risk of the complication when we know that he will have an effect at the end. So therefore, with the coils, we really have to do a proper patient selection. Then we have an acceptable risk, but also a high efficacy regarding the endpoints for the patient. We are researching especially the improvement in patient selection, and then also something which is not possible at the moment. We have the valves, we have the coils, and we have the steam at the moment. The techniques belonging to the company, but I believe in the future we as clinicians will combine the technology, maybe valves on the left side and steam on the right side. At the moment we cannot conduct trial on that because we need the companies, but I believe that by getting more and more information from the CAT scans, we will combine the technology in the future. And so this is something where we're doing the basic stuff to convince the company to share their technologies for our patients.